Okay, great. So we'll start with our land acknowledgement. So if everyone could just be sure to pause what you're doing and focus and give this moment the respect that it deserves. We appreciate that. And if you have any issues with the audio, I should have my audio share on. We shouldn't have an issue, but please do feel free to come off mute and say, hey, Kendra, we can't hear, just in case you can't.
It is the land right here that the Puyallup people have lived on since the beginning.
This
right here is where we are in the world, our homelands.
We work on our ancestral lands. We raise our children who go to school on the land of the Puyallup people. We acknowledge that the Medicine Creek Treaty was signed for the whites to take our land for their benefit.
Land was assigned to our people. The Caucasians said, this is your land, and they took that land from us too.
Our land was stolen from us. Treaties were broken.
But we are still here today. Our people forage for food and materials, we pick berries, we canoe, we practice our traditional ways, and we speak Twelshutsi.
Just as our ancestors did.
We are finished.
All right, thank you everyone for joining me in that acknowledgement. Okay, so up first, I am really pleased to welcome Shanell Brown be presenting with us about Shades of Divinity. Shanell, I will be running the slides for you, but please just let me know when you'd like me to change slides, and the floor is yours.
All right, thank you, Kendra. Let me get my little screen together. All right. Good afternoon. I am not going to lie to you all. My head is all over the place. I just had a vacation last week, and this is, of course, my first day of work, and I feel like I have half a brain. So please bear with me as I go back to the beginning of my slide. So again, my name is Shanell Brown. I am the executive director of Shades of Divinity. It is a new nonprofit here in Pierce County. We are coming up on our 1-year anniversary at the end of December, which I'm very excited about. And so I am going to present on that and just basically give you the reasons why this nonprofit was founded and then the work that we are doing and will continue to do. So before I do that, I just want to give some background about myself. I'm a public health nurse. I have been working in public health for about 4 years and then doing public health nursing for 2 and some change. I started off as a NFP nurse home visitor to Black or African American pregnant folks. My position was pretty unique because, as you may know, Tacoma-Pierce County Health Department has the Black Infant Health Program. And so I was the first nurse specifically embedded into the Black Infant Health Program. So I had like a dual role. And so that's how I had the unique position of having a all Black caseload. And so then I moved on to work as a nurse consultant for the Washington State Department of Health, which I am currently still working at. I work on the perinatal unit to help support their birth equity initiatives. And then I also got my master's in nursing. This year, I graduated in June. And part of my work, my capstone work, was to help support and actually co-develop the reproductive justice curriculum that the Center for the Manning Price, sorry, they just changed their name, the Manning Price Spratling Center for Anti-Racism in Nursing. We started to create reproductive justice curriculum, which we hope will come out within the next 2 years. And so I did that work alongside Dr. Monica McLemore, who is amazing for those of you who don't know. So I always shout her out as many chances as I get because she's my mentor and she's just taught me so much. And also, I recently just joined Ariadne Labs to be a clinical implementation specialist to help support their delivery decisions initiative. So it's basically doing anti-bias work and restructuring their hospitals' delivery systems in various parts of the country. I'm a Wish at Birth Equity member, and I'm a WNAC co-chair. So I have more going on, but I was like, I'm just going to limit it to that for the purposes of this presentation. Next slide. Okay, so as you all know, we are going through a maternal health crisis. So the US has the highest rates of maternal deaths out of the 11 high-income countries, which include the United Kingdom, Canada, and France. The current data states that the maternal mortality continues to rise, and it has increased from 21.1 per 100,000 live births to 23.8 per 100,000 live births between 2019 and 2020. And Washington ranks 17th in the US maternal mortality rankings, with 60% of pregnancy-related deaths from 2014 to 2016 deemed preventable. Next slide. And so diving further into the research, and I know all of you probably know this, but I just like to give context, which is basically building up the reasoning why I developed or started this nonprofit. And so the figure on the left shows the CDC data that shows Black women are three times more likely to die from childbirth than their white counterparts. And it also shows that the maternal mortality is highest for non-Hispanic Black category for all 3 years, and then the Hispanic demographic was the second highest in 2021. And then to the right, you'll see this is taken from the Washington State Department of Maternal Mortality Report, and it shows that American Indian Alaskan Natives have the highest rate of pregnancy-associated deaths, followed by the Native Hawaiian Pacific Islanders. So we obviously know that not only do we have a healthcare crisis, maternal health crisis, we have some health disparities going on within this maternal health crisis. As you can see with these graphics and then other data that I'm sure you have read and learned about. So I just wanted to show this slide briefly. I am going to skip through a lot of things due to my time limit of the presentation, also the nature of you all in the audience knowledge. I know you know a lot of this stuff, but I like showing this social determinants of health graphic because it actually lists examples of social determinants of health factors. But I want to move on to something that you may not have recognized or seen before. So as we know, healthcare is recognizing that maternal health outcomes are heavily influenced by social determinants of health rather than genetics. And an organization called Restoring Our Own Transformation, or ROOT, developed these web of causations to visualize the connection between, sorry, next slide. I'm not sure if I said that. I'm used to turning my own slides, so sometimes I forget that I need to move on to the next slide and let people know that. I'm sorry. So these visualizations show the connection between social determinants of health and maternal mortality in the Black community. So the structural determinants of health are the boxes, the blue boxes with the dashed lines, and these affect the social determinants, which are the red circles with the blue solid lines. So for example, redlining. Redlining is the discrimination of those in hazardous neighborhoods. And usually, typically, as we know, the population that is in the hazardous neighborhoods are those who identify as BIPOC. So being in these neighborhoods and these neighborhoods that have been redlined has led to lack of opportunity, which includes safe, stable, and affordable housing. And this increases the chance of maternal and infant mortality. And so an individual is unlikely to have control over the effects of social determinants of health themselves, as we all know. And these determinants tend to be influenced by institutions and society norms. So if you look at the figure on the right, you'll see that systemic racism that originated with slavery and how white supremacy led to Jim Crow laws, redlining, gatekeeping of the GI Bill. These were all strategies to strip BIPOC people of opportunities and resources. So this leads to social determinant of health risk factors such as food instability, low income, and lack of access to care, which ultimately factor into increased maternal mortality rates. Next slide. So I want to connect this data into Washington State. So DOH also states that the contributing factors to these rates are lack of social support, access to healthcare and behavioral health treatment, which is exacerbated by systemic racism, and issues of bias and discrimination, which are affecting referrals and use of sorry, I can't talk today. I told you my mind is all over the place, and use of standard clinical procedures. So I want to highlight some of the priority recommendations that were made by the maternal mortality panel, and it's based off of DOH's data. So recommendation 1 was to undo racism and bias by addressing racism, discrimination, bias, and stigma in perinatal care. Recommendation 5 was to meet the basic human needs by prioritizing access, to things such as nutrition and culturally relevant support services. So the reason why I'm bringing these up is because these recommendations align with Shades of Divinity. Shades of Divinity was not created on a whim. It wasn't something that I just woke up and was like, oh, okay, I want to create a nonprofit. It's based off of data. It's based off of lived experience as a Black woman and also lived experience as a public health nurse. And just being in the community and learning and hearing from the community and knowing that there are so many folks that are going without. And why is that? It's not due to simply just one's individual choices. It's a systemic thing. And I had the passion to help dismantle and promote reproductive justice. So going on to my nonprofit, our mission is to promote reproductive justice and equality through providing social assistance to BIPOC families and providing charitable events to uplift these families, to show that there's hope. We envision a world where all families have equitable access to essential resources with minimal barriers to these resources. Though BIPOC folks are underserved and overlooked, that does not determine our value. In fact, we believe that there is divinity within every soul. And every one of us, no matter the shade, are divine people, hence the name of our nonprofit, Shades of Divinity. So this work, next slide, I'm sorry. Sorry, Kendra. Going to the theoretical framework slide. This work is influenced by the theory of reproductive justice, which was created by a group of Black women in the midst of the women's rights movement in 1994. So it's just based on 3 concepts: the right to have a child, to not to have a child, the right to parent children one has, and the right to bodily autonomy and sexual expression. So these 4 rights are a guide to our work, and to ensure us that we are following this framework, we have to make sure that our services align with at least one of these at all time. Next slide. So I just wanted to show you all my board of directors in our organizational chart. So you have me at the top, and then we have the board of directors. I'm glad and thankful that I have a very passionate team who's committed to reproductive justice and supporting this work. As you can see, we have a few nurses on the team as well. Next slide. And I want to talk about our services now. So we have 3 main components. So we have scholarships, BIPOC community space, and the Divinity Pantry. So I wanted to create the scholarships and make that a part of the nonprofit due to the need to diversify the healthcare workforce. And we all know, especially here in Washington State, the healthcare workforce is very white. And so I believe it is important to diversify the workforce. And data also shows that you receive better treatment when you are treated by folks that look like you. So we just had our first cycle, and I'm going to talk about that a little later. But we did have our first scholarship cycle, which I'm very excited about. We also plan to have a BIPOC community space. So we want this space to be a free space for all those who have or like to conduct perinatal related events or family related events. And so the reason why this is being done, because I noticed as my work as a nurse that there are a lot of folks that are willing to do this work, such as birth workers, but they don't have the means to obtain a space to carry out the work. So I wanted to host and have a space where folks can come and not worry about paying anything and just host, whether it's their doula support groups or father support groups, any type of work that can help uplift the BIPOC community and promote the strengthening of families, which also contributes to reproductive justice. And then we are also currently working on building up our Divinity pantry, which is basically a pantry which is free of charge, where folks can come and can get things such as diapers, wipes, food, formula. We would like to also offer gently used clothing or donated clothing as a part of this pantry, due to the need of just being able to have resources. Again, everything, the cost of living is crazy. I remember talking to my clients, and it was just so hard for them to get basic needs. So our work is to provide those resources to the community and just make things a little easier, because if you're able to go to our Divinity pantry and get some formula, that's about that saves money that could be put towards other things such as bills and other expenses, and that provides less financial strain to the community. So all these services are free of charge. Next slide. So going on to our scholarships, I want to show you all our current fall 2023 recipients. These are 3 out of the 4 who have received scholarships. We're really excited that they received these scholarships. And like I said, this is our first time giving out scholarships. So it's just amazing that we were able to provide scholarships to these 3 wonderful women who are working in planning to have careers in healthcare and planning to promote health equity. So next slide. I also want to talk about our giveaways. So in addition to our main components, we like to do giveaways. So our first giveaway was in August. I decided that we needed to just get things going, get our name out there, start with some work. And so this time I had to come out my own pocket, and I was like, for August, we have Black Breastfeeding Week and Indigenous Milk Medicine Week. I just want to do basically a raffle where folks were able to fill out this questionnaire and talk about what breastfeeding means to them and other breastfeeding, chest feeding related questions. And they were entered for a chance to win breastfeeding kits or lactation kits. And so this picture shows what we provided in the kits. I tried to make it our aim to give out Black owned or Indigenous owned products. And so we have some products from Milky Mama. They have like these cool little lactation treats that promote lactation. They also have drinks. And then we also have the For Face product, which is also Black owned. They have flaxseed packs and nipple cream. And then I also wanted to make sure there was an element of education. And so we had some books from Indigenous and Black owned authors. And so these were some good treats. These some good giveaways. And I was very excited to give these out and actually receive responses from the community. So next slide. I want to show you all. This is a little screenshot of someone putting on their story, their Instagram story, one of our recipients, that they received their package and they couldn't wait to use them. And around the screenshot, it's just the questions that we put in the questionnaire. And the reason why I did it this way is because I also wanted to collect quantitative data in order to help support our work and to show that there's a purpose. We're intentional about everything we do. We're not just giving out stuff, there's a reason for that. So some questions included, what does breastfeeding or chest feeding mean to you? How has breastfeeding impacted your life of those around you? And in your experience, how do you believe your breast or chest feeding journey has differed from non-BIPOC individuals? So next slide. Sorry if it seems like I'm speeding through this. I want to make sure I get through everything. And I know this is a lot of writing, but I just felt like it was important to put the whole context of the feedback that we received, because there was some great feedback and responses that we received. So one person wrote that they believe breastfeeding is more prevalent in non-Black communities and it's more supported. They've seen Black women be criticized for breastfeeding in public while white women don't receive that level of shame. Another quote says that breastfeeding to me is an act of sovereignty. And it's different for me because as a brown Native woman, I'm expected to fail and just formula feed, but I'm doing it and have for my past 2 kids. And then another one says that I know that breastfeeding was not an option available to all my ancestors for reasons like lack of education or lack of opportunity. It's beautiful as a Black woman to be able to reclaim this piece of our humanity. So as you can see, breastfeeding and chest feeding, it's our right. And it means a lot to us, especially for us who have been oppressed, and the system still oppresses us to this day. And so breastfeeding or chest feeding is not something just as simple as feeding the baby milk or giving them nutrition. It empowers us. It reclaims our right to take control of our lives and our families' lives. So next slide. And then we collected some feedback from those that after they received their kits and how did they like them. So just to read one of them, the Milky Mama products were my absolute favorite. The lactation drink packets were really tasty and did not take long to help with my milk supply. So it's nice to have and give out products that are Black owned or, BIPOC owned that actually help and are tasty too. And so the other feedback was just mentioning how the hot cold pack was going to help them because they had, stopped breastfeeding a year and a half ago due to having lumps from clogged ducts. So they are really excited about using these cold packs because the doctors did not help them with their clogged ducts. And so they were hoping that they were sure the hot cold packs, so the Flexi C pads would help with that. Next slide. I also want to talk about the turkey basket giveaways. So for Thanksgiving, the week of Thanksgiving, we were able to give away 20 turkey baskets at the People's Center. Thanks to the PLU nursing students, we gave away these baskets in less than an hour. There were folks lined and parked down the block hours before the event started. And as you can see in the picture to the right, they got a turkey, they got some cheesecake mix, they got some stuffing, some mashed potatoes, and some other canned goods. And so these giveaways show that there is a great need because, for example, we also did a community market yesterday, and we were able to give out some gift cards to some local grocery stores and also gift cards to free pedicures to promote self-care. And again, it was mainly the homeless population or the unhoused population, and they came rushing in as soon as we opened the doors. And it just humbles me and reminds me that there is such a great need in Pierce County, in Washington State, and that more needs to be done. And so this is my passion, that I just believe in reproductive justice. I believe in health equity, birth equity, advocacy, and just getting out there and doing the groundwork. There's a lot of folks who say that they want to do this work or they care about the maternal health crisis or whatever, but they're not doing it. And I'm here to show everyone that not only that it needs to be done, and that I'm going to do it, and I'm going to make a difference and be a leader in this work. So next slide. And so I just want to end it with this quote by Dr. Martin Luther King: "Of all the forms of inequality, injustice in health is the most shocking and the most inhumane because it often results in physical death." So you notice how MLK did not say health, said health, not healthcare. Our health is not shaped not only by what happens in hospitals, but is shaped by the world around us. This is why all work cannot just be aimed towards healthcare institutions. This is why I am not only working in the institutions with DOH and Ariadne, but I'm also doing the groundwork and working through this nonprofit. because it's important, like I said, to get out there, to listen to folks, to hear their stories, to learn the need and to address that need. I always thought that, okay, if there's a problem, we need to address it. Let's stop beating around the bush. Let's stop talking in circles and talking about things a million times and not actually progressing towards implementation and strategies to get the work done. Let's do it. There is a need out there and a lot of folks are out of touch. And so we need a rude awakening. And with this reproductive justice movement, that's what we're here to do. That's what I'm here to do. And so that's why we need more nonprofits like this and more partnerships. And I'm planning to partner with institutions and organizations such as hopefully Black Infant Health and the Tacoma-Pierce County Health Department and others, so we can promote multi-sector partnership and also work to efficiently tackle this issue, this maternal health crisis that we're having right now. You know, for me, I'm just tired of just sitting and twiddling our thumbs and just talking about things and not being about the action. I'm a doer, I'm a hustler. So this is why I have 8,000 jobs and why Shades of Divinity is one of them. Next slide. And so that is my presentation. I hope I made it within the time limits. I just felt like I had to rush through because there's a lot of information I want to share with you all, but I only have so much time. So if you were inspired or just something stuck with you, just feel free to connect with us and myself. I listed the Instagram page that we have, the FB page that we have. We are currently working on doing more community events, partnering with communities such as the People Center to give away items. And we will have another scholarship application hopefully in the spring, and we will continue to expand our work. And Kendra, I don't know if we have times for questions, but I will be staying on for about 30 more minutes. So if anyone has any questions that we can't get to now, I can answer them in the chat.
Great. Thank you so much, Shanell. Unfortunately, we don't have time for a question discussion right now, but if folks would want to put their questions in the chat for you, that could be a great alternative for getting some things answered while we move on to our presentation on global perinatal services. And we have Taylor Kaminski here with us for that. Taylor, I got your message about alternative slides, and I'm very sorry, but I am not able to access those. It's not giving me permission to do so. So we'll make it work with the slides that we have. And if there's anything that we just want to skip through, please do just let me know. Welcome, Taylor. We appreciate having you, and the floor is yours.
I'm here. I'm going to do the second part of the presentation. Denise Felipe is part of our GPS staff. She's going to go first. Thank you, Denise.
Hi, everyone. Thanks so much for allowing GPS to present. Today, I am Denise Felipe. I am the Perinatal and Lactation Program Manager at Global Perinatal Services. And we're very excited today to share a little bit about our programs. Next slide, please. This is kind of what we're going to go over today. We have various different programs within our organization that we definitely want to share with you all, and hopefully you guys can refer or we can connect with one another about helping the community that we serve. Next slide, please. So our mission at Global Perinatal Services is to create culturally responsive pregnancy and parenting experiences for Black, immigrant, and refugee families. Next slide. And our vision at our organization is that every mother and baby survive and thrive through pregnancy, labor, and beyond. Next slide. And now we'll talk about one of our programs at GPS, and this is our doula services. That includes community-based doulas, birth doulas, and also postpartum doulas. Next slide. So to break down a little bit more about our birth doulas program, we have two different programs that clients can fall under. The first one is our community-based doula program. This is funded by Best Starts for Kids, King County. This is our longer-term doula program, meaning that the doula will work with the family up until baby turns 1. We have 2 trained and certified doulas who speak Somali and provide services in Somali and English. And combined, they have about 2 to 4 births a month. Our next program within that is our birth doula program. This is funded by DOH, Initai Health Foundation, and Satterberg Foundation. It's a shorter term doula support program. So meaning that the client will work with the doula for up to 3 months after postpartum. We have about 18 trained and certified doulas, and we have up to about 20 births a month between all the doulas. And what makes GPS unique is that we have doulas who are from the communities that our clients are from, meaning that they speak the language and understand the culture of the clients and communities that GPS serves within King County and also Pierce County. So we don't have to have like an interpreter or someone else translate for them. The client can just speak directly to a doula in the language that they feel most comfortable in, especially if their primary language is not English. So we have about 10 different languages, and that includes Somali, Amharic, Tigrinya, Arabic, Oromo, Spanish, Dari, Farsi, Pashto, and English. Currently for our birth doulas. And we're hoping to get more so we are able to serve more communities and provide services in different languages. Next slide, please. And in order to be part of our doula programs, there are some eligibility requirements. For the community-based doula program, we ask that they get referred to us 28 weeks or 6 months of pregnancy or less, and that they're on Medicaid, WIC, public health nursing, or they're a DSHS recipient. They also have to be a King County resident. Just because of our funding, they do require that their home address is at least within King County, and they identify as Somali. And then for our birth doula program, we ask that folks get referred within their 3rd trimester, so around 29 weeks to 7 months of pregnancy, that they're also on Medicaid, WIC, public health nursing, or a DSHS recipient. They can either be a King or Pierce County resident. So we've recently expanded our services to provide King County or Pierce County residents doula support. And that they're either an immigrant or refugee or African American, non-immigrant or refugee, and that they're also willing to commit and be part of our program. Additional criteria for both programs, they don't need to meet all of this, but some being that they're a high-risk pregnancy, a domestic violence survivors, limited to no additional family support, or they're attempting to have a vaginal birth after cesarean. Next slide, please. And so our doula programs have different number of visits, or home visit models. And so for the birth doula program, which is the shorter term one, we have a total of 7 visits. And so that includes 2 prenatal visits, a labor and birth visit, and 2 postpartum. And then 2 visits are internal referrals, meaning that they can access services within GPS. So that is childbirth education and also lactation support. And then the community-based doula program will have a minimum of 2 visits per month for either prenatal or postpartum. They'll also have labor and birth support. And after giving birth, the doula must complete 4 postpartum visits within 2 weeks after giving birth if they are part of the community-based doula program, which is our longer-term program. Next slide. This year, we introduced a new doula program, which is our postpartum doula program. Basically, this program offers up to 20 hours of postpartum support to families with a newborn or a baby up to 6 months old. We will be providing that 20 hours of support within 6 weeks of pairing that client up with the doula. And postpartum doulas will provide support and answer questions about newborn care and resources, and also about breastfeeding. And that can include like assisting baby with feeding or assisting with folding clothes while mom takes a rest or washes up. Or that could also be like washing any baby bottles. And then also just speaking with a doula and just being able to talk with someone. That's kind of the hope for this postpartum doula project, is that we hope that, clients feel supported, especially at a transitional time in their life. And so we offer services in different languages, similar to what I mentioned in the previous slide. Next slide, please. We also have a program specifically for first-time Black parents, and this is called the Black Bundle of Joy program. And it's a newer program where we're just assisting first-time Black parents with transitioning into their role into parenthood. Parents will receive free doula services. They can also receive baby items and a $100 gift card from their participation. Criteria for this program includes that they are a first-time parent, they identify as Black, and that either both the birthing individual and their partner attend the classes and services needed. If they are a single parent, they are still eligible for this as well. Next slide. You'll be able to see on this slide here a little bit more about what that support would look like and a little bit about our Black Bundle of Joy program. You can see on the slides here that they have a checklist, or we have a checklist where they can make note of who they're paired with and when they attended that lactation support, childbirth ed, and also father to father support group. So they can keep track of the things they've attended and then also receive that gift card upon completion of those services. Next slide. And branching away from the doula support or doula programs, we all have another service called case management, and we serve the African American, East African, and Afghan community. Next slide. The role of a case manager is that they'll be able to provide doula support, postpartum support, childbirth education, and lactation support to families in person or virtually. They'll also be able to provide ASQ screenings for child development if they need resources for that, for their child or for other children that they might have. And the case manager will also act as a resource connector, referring them to other supports if needed. The case manager will be working with the clients, and the client can range from someone who is prenatal. So if someone is pregnant, we can get them connected to a case manager. Or if they have a baby that's 4 years old, the baby cannot be, or the child cannot be more than 5 years old to be part of this program. And they'll just provide wraparound services to expecting parents of the communities that we serve. So you can see here that we have some eligibility requirements for this. They need to have a child within prenatal to 5 years old, a King County resident, and also if they live in the Tacoma area, and that they identify as an immigrant, refugee, or Black or African American. Next slide. And this is our QR code. If you would like to take a screenshot of this to keep it for future reference, there's multiple ways that you can reach out to us regarding our doula programs and also our case management programs. So you can use this or scan this QR code to take you to the online referral form where you can fill out, and then our coordinators will reach out to the client and get them connected. Or you can just call us or also email us. Our email will be included at the end of these slides, but this is our number if you would like to reach Taylor, who manages and oversees the office phone. If you want to chat with us more, maybe schedule a meeting if you want to hear more about us or a specific program, or if you just have any questions with the client. And I will pass it along to Taylor, and please, if you can go to the next slide. Thank you.
So I'll be talking about the perinatal and lactation piece. Next slide. Perinatal lactation services offered, free access to culturally relevant and congruent lactation, and perinatal supports for families who lack access otherwise. So some of these services are our Easy Access Clinic we just started, which is a really wonderful program. I'll talk more in depth about each of these. Next, weekly, hybrid, and drop-in lactation lounges. We also have a lactation hotline. We also contract with the IBCLC to do home visiting, so our clients can receive home visits for any lactation concerns as well, and then childbirth education classes. Next slide. So our Easy Access Clinic is implemented from the JJ Way model. So it's a really wonderful midwife named Jenny Jones. And she helps reduce disparities and improving outcomes because every parent who chooses to birth wants a healthy baby and that every parent deserves one. So it's the first of its kind in Washington State. We're the first to offer it. And it's for open to anyone, so you don't have to be documented, you don't have to have insurance, and we have interpretation as well. So they can receive midwifery care, they can meet with the lactation, childbirth ed at the same time. And then we have like open discussion, any questions, any other resources that families need, we'll make sure that they get it all in one stop. So we're regularly seeing clients. Next slide, please. So our Easy Access Clinic, like I said, is Tuesdays in Burien at our Burien office. And then we recently opened a Federal Way Birth Center, and we're also doing it on Thursdays in Federal Way. So different options for Pierce County residents because we serve Pierce and King for Easy Access Clinic. Yeah, next slide, please. This is our lactation hotline. It's open for anyone, so you can call it at any time, leave a message if it's after hours, and we try to navigate any lactation concerns or needs. And like I said before, we contract with IBCLC, so we can do home visits if getting to our lactation lounges. On Tuesdays, our hybrid lactation lounges, we're going to be offering it soon on Thursdays as well in Federal Way. Because it coincides with our Easy Access Clinic. So we want families to be able to see a midwife, get education on breastfeeding and childbirth education and any other resources they need all in one shot. So they're not having to go and wait and just a one-stop shop. Next slide, please. Some of our support groups. Next slide. So we have Mom's Corner. And it's held every Saturday, or actually it's held on Saturdays. It's usually once a month now, sometimes twice. We have doctors from Swedish come through. We have different midwives, different community members. Our subjects vary. We also try to engage, other moms and families to, people that they want on, and we also provide a stipend for that, so it's open to anyone. Just register beforehand. We usually always promote our things on Instagram, so a lot of times these sessions are on there. We have Aroma Sisters Corner that's usually in person and just engaging Aroma families, father-to-father support groups for dads because they need education on childbirth and pregnancy and all things just fatherhood in general. Our last one was talking about the war and just how families are coping with that. And then we have an Afghani Sisters group. So it's one of our most popular ones. There's a lot of our clients are from Afghanistan, and so they really look forward to this. There's also a stipend for that as well. Next slide, please. And then this is our GPS doula certifying program. Next slide. So we just started certifying doulas this year. It is part of our global prenatal services. We wanted to make it accessible for families, for clients as well to be certified. A lot of times our clients end up wanting to be doulas because they just love the doula support that they received. Next slide. So, we're offering birth doula certification, both postpartum doula and full spectrum doula certification are coming soon. So certification is good for 3 years. Next slide. So becoming certified. So usually we do a doula training as well once a year. So if you are looking to be trained, we do that as well, but this is just a certification process. You basically buy a packet, go over our vision, mission, and value statement, our standard of practice, our code of ethics, our core competencies, And then a letter of recommendation from a community member. Maybe you were at a birth with a family that you supported, family member. It could even be like your sister, just in depth, somebody that could recommend that you were at a birth and your experience with that. Also attend a doula, a monthly doula certification meeting. Complete and submit the application and assessment, complete an interview with our doula coordinator, and complete some recommended readings as well. Next slide. This is our website to do that. We have a new doula service coordinator. But yeah, so this is just, it's part of our website as well. So you can find it on our website or this website. If you're interested in becoming a doula and serving the community, we're always loving to certify folks. Next slide. And yeah, so any questions about any of our programs, feel free to email. And this is our number as well. And our Instagram. Our Instagram pretty much stays up to date with our regular things that are happening. And I'm pretty on, Denise also put our website as well. Feel free to reach out if you have a referral. We have a referral link to both our Easy Access Clinic and our doula program. So it's accessible to anyone. Providers can fill it out, clients can fill it out, anyone can fill it out. It's on the top of our website. So if you're interested or know somebody that needs a doula or needs to see a midwife, you could reach out there. Thank you so much.
Thank you so much to the both of you. I just wanted to let you know that I think we could afford like maybe 2 minutes for questions. I know that folks have been putting some in the chat, so thank you for getting on those. But yeah, maybe about 2 minutes for some oral questions now if anyone has any. Looks like maybe perhaps everyone's getting them put into the chat. So I really appreciate you being able to get the answers into the chat for folks. And if that's everything, we will go ahead and move on. We are back on track time-wise, so great job, everyone. We're going to move on to Annie Tu and Kate Cranfield are joining us from Tacoma-Pierce County Health Department, Communicable Disease Division. And let's see, they will be chatting with us about RSV immunization recommendations.
Hi, good afternoon, everyone. Can everyone hear me okay?
We can hear you great. Thank you,
Okay,
Annie. Lovely to have
perfect.
you.
Thank you. So hi, everyone. Good afternoon. My name is Annie Tu, and I am a public health nurse in the Communicable Disease Control Division at the Tacoma-Pierce County Health Department, and I work in immunizations. So today I will be talking to you about the RSV products that were approved this year to protect infants and young children, as well as the recommendations and current guidance. Next slide. All right, so what is RSV? So for those of you that may not be too familiar or need a refresher, respiratory syncytial virus, otherwise known as RSV, is a common respiratory virus that usually causes mild cold-like symptoms. While for most people, they do recover in 1 to 2 weeks. However, RSV can progress into severe infection, and this can become particularly serious in infants, young children, and older adults, and result in hospitalization. In the US, RSV is the leading cause of hospitalization for infants, particularly those less than 1 year of age, and especially for those 6 months and younger. RSV season does start in the fall and peaks in the winter for most regions in the US. Next slide. So what can we do to protect infants and children and the public against RSV? So one of the ways is through RSV immunizations. So this year, the FDA did approve 3 different products for RSV protection. 2 of those are intended for protection of RSV for infants and children, which are listed here. The first 2, I will be going into more depth in the next couple of slides, but those include nirsevimab, which is a monoclonal antibody, as well as Abrysvo, which is a maternal vaccination. While today the focus is on infants and young children, I do want to point out that for adults 60 years and older, there are 2 RSV vaccines that are available, Abrysvo and Arexvy, and those can be found widely available at most pharmacies. Other ways that we can prevent the spread of RSV virus is through practicing everyday preventive measures. So that means frequent hand washing, covering sneezes and coughs, staying home when sick, disinfecting high touch areas, and avoiding close contact with others. Next slide. All right, so now I'm going to go a little bit more into detail in regards to the 2 RSV products that were approved this year by the FDA to protect infants against RSV. So the first one is nirsevimab with the brand name Beyfortus. This is a monoclonal antibody given similarly like a vaccine, but is an injection single dose. It is recommended for infants birth through 8 months, born during or entering their first RSV season. Also recommended for high-risk toddlers through 19 months of age as well. The nirsevimab is part of the Washington State Childhood Vaccine Program as well. And as many of you may already know, there is a current shortage. And given the shortage, there is currently a prioritization guidance in place. So for the state of Washington, the DOH is prioritizing nirsevimab doses to birthing hospitals, as well as tribal clinics, and they are also distributing limited supplies to pediatric offices throughout the state. Because of this shortage, it does mean that some parents may run into the issue of not being able to find a dose for their young child and infant. So parents should really be having a discussion with healthcare providers about the local availability and the likeliness of them finding a dose for their infant. But in some cases, they may unfortunately be able not to get their child a dose. The second product for RSV protection for infants is with the vaccine Abrysvo. So this is a maternal vaccination given as a single dose. This is recommended and approved for pregnant people 32 weeks and 0 days through 36 weeks and 6 days gestation, typically given September through January. And for infants born to mothers that did receive Abrysvo at least 2 weeks before birth, those infants are considered protected against RSV and would not need a dose of nirsevimab once they are born. Abrysvo is part of the Washington State Adult Vaccine Program through the end of January 2024. However, supplies are limited. Abrysvo is becoming more and more available at select pharmacies and clinics. And there is an Abrysvo vaccine finder that patients and healthcare providers, as well as those professionals that work with, expectant mothers and families, there is a vaccine finder in which they can go to find the nearest location to get that vaccine. Given the shortage of nirsevimab, it's really important that healthcare providers and those, participating in the care of the expectant mothers to really make the patients aware of this availability of Abrysvo and really encourage and recommend the vaccine to get their infants protected. Next slide. All right, and then we'll talk about efficacy and safety of these 2 products. So for nirsevimab, it does reduce the risk of RSV hospitalization by about 80%. It is safe to co-administer with other vaccines, and most common side effects are pain, redness, and swelling at the injection site, as well as rash. And for Abrysvo, the maternal vaccination, it does reduce the risk of infant RSV hospitalization by 57%. And it's important to note here that Abrysvo is approved and authorized to be administered at 32 to 36 weeks gestation and not be given any sooner than 32 weeks in order to reduce the risk preterm births. In the clinical trials, although not statistically significant, there were more preterm births that occurred in the people who did get the vaccine at 24 to 36 weeks gestation. So that's really important, especially if you're the one administering or recommending the vaccine, that the mothers do not get it any sooner than the 32 weeks. Despite this, ACIP and CDC still highly recommend the maternal vaccination with the Brisvo, given the benefits outweigh the risks. It is safe to co-administer with other vaccines. However, it's not yet known if another dose will be needed in later pregnancies. Brisvo is monitored in VSafe, which is the CDC's vaccine safety monitoring system that allows patients to report on any side effects that they may be experiencing or any adverse effects as well. So this really helps the CDC to gather data on the vaccine safety profile of the vaccine. Most common side effects of a Brisvo is pain at the injection site, headache, muscle pain, and nausea. Next slide. All right, so the main takeaway and the guidance here is, yes, there are 2 RSV products to protect infants and young children against RSV. However, given the shortage, pregnant people and their providers and their healthcare teams should really consider the limited availability of nirsevimab during the 2023-2024 RSV season when making decisions about the maternal vaccination. And we really encourage all healthcare providers and health team members to encourage and recommend the maternal immunization with a Brisvo in order to protect the infants, given the uncertainty of the availability of nirsevimab once they are born. All right, next slide. All right, so that is the end of my presentation. I'd be more than happy to answer any questions that anyone might have about the RSV products. Otherwise, you can contact me here at my email if you have any other questions. Thank you.
Thank you so much, Annie. Really appreciate your time, and that was a great presentation. I think we can spare, again, just a couple of minutes if anyone has any oral questions they'd like to present to the group. No? Okay. Let's go ahead and move forward then. We have made it to our final presentation. For today, we have Stella Johnson joining us to speak about early support for infants and toddlers.
Good afternoon, everybody. Hi.
And you have until 1:30, Stella.
Okay, thank you.
Thank you.
Well, thank you so much for all the presentations so far. This has been a great meeting, and hopefully we'll round it out with a quick early support for infants and toddlers, or ESIT 101. Next slide, please. So what is early support for infants and toddlers? We are developmental services that are provided under public supervision. And this often looks like therapy and caregiver coaching conducted in homes in natural environments. So we have providers that go out to families' homes primarily. And it's really designed to help support the families and parents to help teach their children to develop and learn. Next slide. What is the purpose around the early support for infants and toddlers program? Really, again, it's to build that strength in the family by providing coordination, supports, resources, and services to enhance their child's development that may be experiencing a developmental delay and or disability throughout everyday learning experience.